right, this week we're covering some neuroradiography related to spine imaging that you might be doing both in the radiology department, in the operating room, or say a pain center. A neurologist is a radiologist who has specialized training in neuroradiology. So they interpret images of the central nervous system, essentially the brain, the spinal cord, and any surrounding structures. Central nervous system includes brain and spinal cord, and then peripheral nervous system is your ganglion and nerves. We're going to do a quick anatomy review of those areas. So your three subsections of the brain is the forebrain, which is the cerebrum and the largest part of the brain. The midbrain connects the cerebrum to pons and cerebellum, and then the hindbrain is the cerebellum, pons, and medulla oblongata. The spinal cord lies from the foramen magnum to the border of L1. It tapers at the conus medullaris. It's about 45 centimeters long. There's 31 pairs of spinal nerves and 12 pairs of cranial nerves. This cauda equina, horse's tail, it's a bundle of spinal nerves and spinal roots. So you might see that labeled as well. These are just a quick review of spinal nerves and cranial nerves. I know that A&P is going to come back to you. It's back there in your filing cabinet somewhere. But 31 pairs of spinal nerves coming down, obviously the cervical ones are in the cervical area, thoracic, lumbar, sacral, and then the ones in the area of the coccyx, and then the 12 cranial nerves. The spinal cord layer. So the spinal cord is enclosed in protective membranes, and they're called meninges. The meninges have 3 layers. The dura mater is your outer, arachnoid is the middle, and then pia mater is the inner. There's 3 spaces also involved: the epidural, subdural, and subarachnoid space. The subarachnoid space is the one that we are going to mention quite a bit in our studies. It's the one that is filled with cerebrospinal fluid. And that's usually one of the main areas of focus in any of our, say, myelograms or lumbar punctures. A basic review of some vertebrae anatomy. Pedicle and lamina, right? Remember, your pedicle is closer to the body. Lamina is out by the spinous is out by the spinous process. It looks like it's leaving. There are some significant differences between cervical, thoracic, and lumbar vertebrae. Remember, the thoracic ones have that bifid tip, so the spinous process is split. It also has transverse foramen, so these openings in their transverse process. They also are smaller. C1 and C2 are in their own world here. The atlas and axis, they have their own makeup. One does not have a body, right? The thoracic vertebrae have the rib facets because that's where your ribs attach. The spinous process points down or inferiorly. And then lumbar vertebrae, they look a little bigger, a little chunkier. They have a short spinous process that points straight out. So the larger vertebral body, and they'll be at the end here. I think their spinous process are just a little blockier as well. I feel like the thoracic vertebrae looks like a giraffe. Not sure why, but now you won't unsee it. All right, we'll be back for part 2.